we're talking about, there's always also a discharge. And after that, there's always a burning sensation. King Komajoyon. You know, at time you go and pee, go and urinate, and you feel this burning sensation. So that's what I'm trying to talk about. That when we have a genital candidiasis, there is a burning sensation around that vulva. And I said vulva only. Oma Yoruba máa sọ pé awẹ́. Even using this awẹ́ may be big for some people. That's the opening, the mouth of where we call the main opening of the female reproductive tract. So that is the vulva. And I've said before that yeast can be found in different parts of the body, different parts. That's when we can see an yeast infection. I'll talk about the mouth. You can also find, but normally it doesn't cause any infection because it is what is in our body. But when there is not a misbalance, when the balance, as in there is the proportion of the good and bad one, that's when we can now start having that this thing is not giving a problem, it's giving me an infection. So I also want to ask us now that what does a yeast infection look like? Has anybody experienced? No, I've said that every month there is always a normal discharge. There's always a normal for those of us that had our menstrual cycle. There's always a normal discharge every month from the vagina. So when do you now think you have something different from the normal discharge? My sister here said mucus discharge, and I said mucus discharge is the normal discharge that happens every month. But you know that the time of the month, if you are very observant, you know that, oh, this occurs after my menstrual flow. Mucus, I can see mucus discharge. Before my menstrual flow, I see watery discharge, which is not smelling and it is not itching me. So that is still normal. So what does the yeast of genital candidiasis discharge look like? Hey, I think this sister is going to be my partner. Oh. My assistant, she's the only one talking. Oh. Eh? Auntie, you are a nurse or a medical officer too. Eh? Biology student, does that mean? I believe biology is a general course. Oh. Is it a general subject? Every science, commercial, and is it also? Biology is for everybody. Science, commercial, and arts. It's when you now leave secondary school, it cannot be. Is mine. Okay. Colored and smelling, that's a yeast infection when there's an infection. Okay, right. She said there is always when there is she said when there's yeast infection, it's always color and smelling. That is what she said. Well, I said right, but it's not right for that. When there is a smelling discharge, there's definitely an infection. But this candida that we're talking about is just very different. It doesn't smell. But the discharge, yes, a candida infection does not smell, but there is always a discharge. It does not smell, but it itches and it burns when you go and urinate. But it's a very classical, the side of a candida, yeast infection is very classical. If somebody, how will I put it, you can get, as in, even without any microscopy done, you can, if the person explain well and you're able to see, you can pinpoint what a yeast infection is. Okay, I know somebody, she said mucus and somebody said watery discharge. I said that, but for a yeast infection, it's always thicker and lumpy. When something is lumpy, bẹ́ẹ̀ ni kó ní kókó, that mean of lump. As in when you pass a discharge and see it in your pants lining, you see that this discharge is white, oh, white discharge, but it's thicker. It look like the mucus. That mucus discharge is always like the egg white. Have you seen the egg white before? Gbogbo láti fọ́ ẹyin rí o. Àbí tó bá dẹ̀ fọ́ ẹyin rí, ó fọ́ ẹyin ṣojú wa rí. That white part of the egg, that's what I'm calling egg white. You know there is yolk and the egg white. So the normal discharge that comes from our body at times is always like that egg white. And at times it's always watery like tap water. But for a yeast candida infection, it's always thick and lumpy. Oh madam, kó ní kókó. But oh man, funfun. So and it doesn't smell. So at times some people may not be able to pay attention, but when they start having this discomfort, that's where they know that this is different from my normal discharge I have every month. So they are now asking now, who can get yeast infection? I don't want her to talk again. Who can get yeast infection? For anything I've been saying now, who do you think can get a yeast infection? Is it Abdulhakim? Ehen. A female is the one that can get yeast infection. But even for a female, the time a female can get yeast infection is what we call the reproductive years. The reproductive year is the time between when you start your menstruation, the first year, the first day. I am 10 today, I'm 11, 12. I'm having my menses. Today is the 14th of October. That is what we call menarche. The first day I'm having my menses, it's called menarche. You know that some of our aunties, some of our mommy and grandma, they are not menstruating again. They pray every day of the month. So that is called menopause. So the period a woman can get even yeast infection is the period from her menarche to her menopause. The time she still seeing blood, the time you know that I'm still affecting my menstrual cycle, that's the period. Even when she's pregnant, she can get yeast infection. Those times. So it's a female in her reproductive age is the one that can get a yeast infection. I think I start asking question. Eh, you see one, maybe I should mix the all. You see one part of the hull is more active than the other. Maybe again, and if I look at it, one part of the hull, I'm sorry to say, maybe they are the age range or kóra wọn by sex ni. Other about our sex kan múra wa ọmọ class ni. Àwọn ọmọ jẹ́ ẹ̀zọ́ ìkàyọ̀ kọ̀ báyìí, àwọn ọmọ ẹ̀sẹ̀ ẹ̀sẹ̀ ìkàyọ̀. So maybe the understanding of the thing is looking somehow to my. I don't want to be wavy to one side. Ó dàbí mama béèrè orúkọ ń sìn. So about 75% of a woman during her reproductive life can get yeast infection. I don't know how many we are in this hall. Let's say we are 100 in this hall. About 75% of us, before we say that we stop menstruating, before we get to menopause, we will get yeast infection once in our lifetime. And it's not about I am dirty, I am clean. About 75%. So that means if we are 100 in this hall, about 75 people from this hall will get yeast infection once in their lifetime. And about 50 of these people in this hall will get it like more than 2 times. As in more than once, 2, 3 times in their lifetime. And it's not a means of dọ̀tí ni nǹkan ló ń ṣe. It's not a thing of imbalance from our system. So that's what causes this infection. Okay. So what are the things that we call risk factor? Kí ló lè Yorùbá mi ọmọ Yorùbá ni mí ò bọ̀ sí no kí ọmọ tú medical sí Yorùbá náà is not something that very easy. Kí ló lè as in the risk factor kí ló lè jẹ́ kí a ní kí ni àwọn nǹkan tá lè ṣe that will predispose us to having this infection. I've said oya please who think that although it's a normal thing in my body but if I don't do anything or if I don't do what I'm not meant to do or do anything anyhow, what do you now think that thing to make normally this thing is meant to be 10 in my body and the 10 in that place is helping me keep my body okay. But by the time they become 50, it become an infection. So what do you think I will do that I will now change the medium, change the number of those organisms? Anybody? Sharing of toilets. So another thing, hygiene. My sister this my right hand side now. Another one, sister in pink, menstrual hygiene. Thank you. Sister in pink because I sister in pink, I start still looking okay, lilac or pink. You borrow me that hijab, ma get this size of money. Oh yeah now. Sister mi ò okay. What's your name? Sister in pink beside a brown one and white hijab. My smiling sister, tell me something now. Okay. Everybody, did you hear? Public toilet, menstrual hygiene, dirty undies and what? So, fine. Public toilet, although it's not as if I will go to a toilet now. I see that it's dirty and I will sit down there and I will serve wee. No. But if I prove like don't say prove it, I can tell you and we can now go ahead and prove it that we don't really contact infection through the use of public of toilets. Fine, you may have rashes around that area, maybe because of the splashing of water and everything. But by the time you clean yourself and not something very serious, you not really get an infection that will now have to like you have to treat it, use this antibiotics, use that antibiotic. Somebody say menstrual hygiene and wet and dirty on this. Yes. But one of the things I would say is antibiotics. Fine, we've not gotten there. But people, when they come and see an health worker, I'm having discharge. I believe the older females will understand, like the university student. I'm having discharge. I have to ask them that, okay, what's the color of your discharge? What are the normal discharge I've said today? White. One will be like water and it will still be, and the other, yes, they can be cream off white. They can be off white, which is still normal. They can be like water, and they will be like that egg white. Even everything will say transparent, let me say white. And it's water white. So those one are still normal. But some people they don't want to have discharge. You now wonder if you don't have discharge, what is wrong with your body? You don't have to have discharge. Every time of your cycle have different discharge. So then when they start discharging, they don't check it. Is this many? Is it itching me? Is it doing? They start using antibiotics. So the more you use antibiotics, you kill. There is something we call good bacteria and bad bacteria. So by the time you use antibiotics, you kill everything, both the good and the bad. And when you don't have infection, so that means you don't have the bad infection, bad bacteria, and you start using antibiotics. So when antibiotics go antibiotics, biotics is bacteria. Anti against it, kill. So that one is going to kill all the good bacteria, and you don't have infection because once you have used it, so once you use antibiotics, even prolonged use for people that have infection, you will kill the good one and make them predisposed to infection. Meaning that ó máa pa nǹkan tí kò yẹ kó pa, ó máa ṣí ara wọn lẹ̀ fún nǹkan tí kò yẹ kó bá wọn jà kó bá wọn jà. I hope you can hear me. I hope you understand, not even hearing me now. So another one is when there is immune imbalance, hormonal imbalance. This hormonal imbalance, this is for our married sisters because even one, you are a Muslim child, you are a Muslim girl, and your virginity is your pride. Let them say no matter what social media anybody is saying, nobody pray that you should be 30 something before you get married. But if you're even 30 something before you get married, your virginity is your pride. So for hormonal imbalance, one of the things you can get hormonal imbalance through is pregnancy. When anybody is pregnant, because the way Allah has destined, just because so that the woman will be able to carry the pregnancy, it will lower some hormones, some things. Off it. I think that one, this one is for recording. What is now this one for again? Please, can you hear me? I don't know why I have to use two mics. If I should use two mics, so everybody will be hearing me from outside. Okay, so I've thought about hormonal imbalance, and one of the places that you can get hormonal imbalance, one of the reasons is being pregnant. Because Allah wants the baby to survive and get to term, and you deliver an healthy baby. So some of the immune system, some of your fighting system is going to be down. And when your fighting system is down, there is likelihood for a bad bacteria, bad organism to start acting. So the pregnant women too are more prone to having vaginal candidiasis. Okay, having a health condition. What are the health conditions that lowers immunity that you know? I'm looking at you, but I don't want you to answer my question. What are the health conditions that lowers immunity? Please, what's the full meaning of HIV and AIDS? Okay, let's all stop. Immunodeficiency. What mean of immunodeficiency? Ó ti lower immunity ni. Immunodeficiency. Immune, deficient, immune, minus. Abi? So those are the conditions that lowers people's immunity. HIV, AIDS, because they're immunodeficient. They make the immunity not to be sufficient, not to be enough. Another one we have is diabetes, because the sugar, like your blood and other things of your system is swimming inside sugar. So it's like literally don't take fojú wo pé ó ń yàn dín gbogbo kan yẹn tí ń yàn dín, so they will not be able to act as normal as supposed to act. Another one is somebody that have cancer or is undergoing all those treatments for cancer, like chemotherapy, because chemotherapy kills other organisms. I'm now talking high. Ó ti ń pọ̀ jù àbí? People can raise up your hand just to tell me that, please, I'm not saying jargons, because I'm trying to blend both. So that is on. And as my sister said earlier, that wet pants, wet underwear. So some lifestyle something too can make us predisposed to having yeast infection. Example is sitting on wet bath. Some of us tá bá ti lọ síbì kan, tá bá ti rí bathtub, mo rò pé bathtub yóò comot. You don't know when last the person that have been using the bathtub have washed the bathtub. We will now fill it with water. We will sit down there with our naked body. So there's likelihood we can get it from a bathtub. So that is also the analogy for a seat, because of the wetness. And also from if your underwear is wet, maybe by cleaning yourself, ensure you always wear a dry underwear, because any wetness can predispose, ibẹ̀ yẹn moist, so it will give room. It will give room for it will give room for yeast to grow. So, and also some people, there are different type of pad now. We have different type of pad, and some of them have perfume. Am I wrong? Imagine the pad with perfume. I think it scents nice. Before you use it, it scents nice. That part. So some of us use, do you know what they call pint liner? Some pint liner too, when you bring it like this, it's smelling like one baby powder. So we should avoid using all those pads and pint liner that are scented. As in scent, that it has scent, because the scent is going to interfere with the normal medium, the normal way our vagina something is, and to cause it to have to produce more yeast infection. So what are the things we are going to see? Can you permit me to sit down so I'll be able to concentrate and attend to my baby? So the symptoms that we are going to see, I've said this as I was talking earlier. Symptoms, I said about two. Itching. Please, what's your name? Nima what? I think Nima will be sitting, you will continue my lecture from here. I've written it down, Shishi. Because is she the only one listening? So we have itching, burning sensation when those are the symptoms you will see. And there is something like Al-Munawwarah. Ta ló mọ kí ló ń pè wàrà ní òyìnbó náà? They say cheese. Wàrà, have we seen it before? Although the one we see in the market, tí wọ́n sì dín o, tútù, bó ṣe máa ń rí, ó máa ń ṣe bí ẹni pé milk tó kọ̀ ti dì bọ̀ kò dì tán. You know when Bonvita, Milo, all those our beverages, if they're going to solidify, they always add. But this one, when you mix it like this, òun náà máa mix it pẹ̀lú container yẹn. So it has the discharge from yeast infection is always like a cottage cheese. So some of us bóyá gbàgbé àbí no ká má gbàgbé ká mú toothpaste wa, maybe a tẹ̀ sí ibì kan nínú bedroom wa, By the time you come there the next day, that toothpaste will have been dry and flaky. Ṣàtìrírú So that is how classical the stage of a yeast infection is. It will like a cottage tea, wàrà tó ti rún, kò ń ṣe èyí tó fọ́ọ̀mù gan, but pé ó máa thick, ó dẹ̀ máa funfun but kò ní funfun tán. So òun ni that's the start from a sorry o. So that is the start we get from yeast infection. Did we get the how the discharge look like? I've said pé ó lumpy lálákọ̀ọ́kọ́, it's always thicker, it's like our normal discharge but it's thicker and it's lumpy. So kẹ́ tí wá fi ṣírò pé wàrà tí kò tí wàrà gan ò kí ń dì, kò ń ṣe èyí tó ti dín di tútù, bó ṣe máa ń rí bẹ́ẹ̀ ni pé tẹ́ bá fọwọ́ kàn ó máa tún change shape, tẹ́ bá tẹ̀ it can go inside but it's thicker than you just putting pap down. So bí ó ṣe rí nìyẹn. Another symptom tá a tún máa rí from yeast infection is redness. Ojú ara yẹn redness, ojú ara yẹn máa pọ́n, at times ó dẹ̀ tún máa ń wú because the person is itching and ó dẹ̀ tún ń dùn tó bá tọ̀, so ó máa jẹ́ kí ibẹ̀ yẹn pọ́n. So there is the swelling, there is redness, there is itching, there is burning sensation, and there is this classical discharge of a cottage cheese ni a máa ń rí níbẹ̀. And tí èèyàn bá tún wo ojú ara yẹn dáadáa máa dàbí pé ó nílà. Some people's leg, because some people's leg have crack, so that one too there may be crack by the time you look at the surface of the genitals. So báwo la ṣe máa ń diagnose at the diagnosis? By the time you go to an health worker now, they are now saying you have a vaginal infection. Okay, how do we diagnose? The diagnosis of genital candidiasis is so easy. From what the patient is saying and from examination. Examination means I will look at it. Oh, this is it. No problem. From what the patient has said, ó ń yún mi, ó ń ṣe báyìí, bá fẹ́ tọ̀ ojú ara máa ń jó mi. And when I also look at it and I saw a very thick discharge, I can say 100% that this is a yeast infection. But another thing we now do is just take a sample and we go for microscopy, which will also come back as candidiasis. So that is just the way to get diagnosis. So for treatment, and I've said before, it's not only married people that can get yeast infection. So let me break that down. It's not only virgins or non-virgins that can get yeast infection. Both virgins and non-virgins can get yeast infection. So when you go to the health center, because when you go to the health center, you should be able to be outspoken. I don't mean you should be rude, because the way of examination can make you lose your virginity. So you don't have to tell this person, I am this. Although the medical is saying in this century, but you tell them. So there are ways they will be able to take your own sample from somebody that is not a virgin. Like me now, if I go there, how would they expect? I have children now, so they expect, oh no. So they may not believe you, so you just have to tell them. And that the same thing goes, some people may not do tests for you. If you come and you are able to explain yourself better, you may skip the test stage. But even the treatment too, there are some treatments that will require you to put something inside your vagina. And there are some treatments that can also be given that you don't need to put anything inside your vagina. So you don't have to, once your medication has been prescribed to you, some people will not tell you that at night, take your bath, put this one down your vagina and lie down and sleep. They'll just tell you, and you go to the pharmacy, you now be wondering how to use it. So if you are fortunate that the doctor or the pharmacy tell you, you are going to put this inside your vagina and you are not married, I believe you are not married. Your virginity should still be there. You tell them, I am not married, I am a virgin. So they will give you a substitute that you will use that does not need to go inside. So that's for the treatment. So because believe me, nobody believe anybody. I only believe myself. So that what they all say, even in health. If you tell them you are a virgin, even me, if you tell me you are a virgin, if you come and some of your system is looking, some of your system is looking somehow, I'll say go for pregnancy test. I know people fight me and say no problem, just go for pregnancy test. I can even pay for the test. So I'll be able to be sure that the continuum kit, the pregnancy is out of it. Because this our community now, we just pray because that is the best. You know what it means to be involved in zina. And you know how Allah said it. Allah did not say don't do it. So he said don't go near it. So don't go near it. But when you get to the hospital, you should be able to, at least when it comes to the treatment and diagnosis, so they will not be the one to now cause make you lose your virginity. So the treatment includes reusing antifungi. As I said earlier, I said it's a fungus infection. So we use antifungi and normally within 3 days, it's not a very stubborn infection. Once you treat it, within 3 days it should go. But even if it doesn't go, a whole 1 week is enough for it to go. But one thing, let's say that the infection looks so similar to normal discharge, only that it is itchy, it is more thicker than a normal discharge. It will not go on its own if you don't treat it. It has to be treated. Either you use oral drug, as in drug that you swallow, or most of the time it's always drug that you swallow and something to put around that area. So those are the treatment for it. And they will also teach you some basic hygiene. One thing about this infection is that they will tell you try to wear cotton panties. As in anything you want to wear, make sure your pants is cotton. Your is cotton, and ensure that your pants is not wet. Don't wear wet clothes. Don't wear tight fitted clothes. You see some people all their life what they wear is tight, everything tight. You need to wear loose fitting clothes also because that place don't need to expose it, and also it also needs some hair. So everything being tight